All right, a very good morning to you. It's good to see you today, and that is the 9th day of October 2024. We have a very important conversation lined up for you, and this is as far as World Sight Day is concerned, because World Sight Day is an international day of awareness, and this was organized by the International Agency for the Prevention of Blindness, and it is held annually on the second Thursday of October to focus the attention on the global issues of eye health. However, this year the commemoration will take place today, all right? And this is with the governments worldwide encouraged to actually participate in promoting initiatives that enhance eye care and prevent vision impairment. Because tomorrow, as we all know, is Mazingira Day, but it's also World Sight Day. But again, it's important to start these conversations early so that we do not lose the importance of the same. And that is why we're having that conversation today right here on Your World. And we'll be focusing on a very important aspect, and that is on Love Your Eyes, but also eye care for all children. So why is this very important? That is the conversation that we're having this morning. And what are we doing? How are we doing as a country? And what are some of the gaps? And what is it that we need to do? Okay, so much to cover in today's conversation. So I'll begin. My guests are already here to help us understand this conversation. I'm just going to begin from my left. And we have Samson Waweru, who's the CEO, Kenya Society for the Blind. Good to have you this morning. Thank you so much for your time, Samson. Next to him, we have Dr. Michael Gishangi, who's the head of eye health section from the Ministry of Health. Good to have you, Dr. Gishangi. We also have Sheila Luta, who's the Assistant Director, Ministry of Education, Special Needs Education. Good to have you. Thank you so much for your time, Sheila. And last but not least, we have David Munyenda, who's the Kenya Country Director, Christian Blind Mission. Thank you so much as well, David, for joining us this morning on this very important conversation. So Sheila, I'm just going to begin with you. So this year's theme, focuses the attention, like I said, on eye care for all children, but there's also the other special emphasis, and that is love your children's eyes, right? So can we talk about the significance, first of all, of this day and why this, focus on these two very key areas?
The World Sight Day is very important to us because this is a conversation that we are running to loop in the Kenyan child to ensure that we provide the necessary knowledge and skills and even the right attitude towards eye care, knowledge on eye health, and how to prevent eye loss. And in a situation where it's already lost, then how can we make sure that we still see through the various accommodations? So indeed, for the Kenyan child, it is good that they love their eyes. We love their eyes and give them a chance to take care of their eyes.
Okay. And someone would say, so when we talk about love your eyes, right? Because everybody would say, but I love my eyes. I wash my eyes in the morning. I try not to rub, but sometimes, we find ourselves, rubbing our eyes and all those things. So, Dr. Gishangi, I'm just going to throw this to you. When we say love your eyes, and in this case, the children, right? What exactly do we mean? What is it that we want them to really understand about loving your eyes?
Thank you, Winnie. Anything you love or any person you love, you take care.
Okay.
So what we are saying is take care of your eyes, and especially take care of the children's eye. And it is good to ensure that children live a life with their good sight. And there are several implications of that. So basically that is what we are saying. Let's take care of our eyes. Let's give special emphasis to the eyes of children, and they'll have a better life.
All right. I also want to hear from you, David, because again, you do a lot of, work, and especially, with the communities and all those things. What is it that you see, and especially from, our children? Let's talk about the society in general, because it is the children are under someone, right? Either under a parent or under a guardian, or teachers in school. So what is it that you have seen? What is it that you have noticed?
Thank you, Winnie. The clarion call for this World Sight Day simply is around fostering collective responsibility and ensuring that we have a shared vision so that all our children have good health in terms of vision.
Okay.
Now, we support so many programs around the country, and what we notice that it's true, every child has somebody who's taking care of them, be it at the family level, be it at the school level, be it at the community level. Right. And now the role of this adult person who is in charge of this child to ensure that this child is taken care of, either through screening, either through keeping the face clean, either ensuring that this child is treated in good time where there's a problem, and ensuring that if this child has spectacles, they are using them consistently and appropriately. And the most important thing is about information. In most cases, we find that parents have got little information on how to take care of the eye health of these children. Okay. And where they have, sometimes they're just perceptions or misconception. So we ensure through a program that there's correct information flowing outside there, and children have access to quality eye care services.
Yeah, and I like the various points that you're bringing up, which again we'll be discussing as we continue with the conversation. And one of the things is, first of all, information, and then there's also the whole aspect about access, but also treatment, because there's several cases that of, I would say, conditions or diseases of the eye that sometimes go undiagnosed, and then there's this whole aspect about stigma as well. So there's so much to discuss really when we talk about eye care. And Samson, I'm just going to go back to you and to understand, and especially for children, and I just want us to go all the way back to your childhood, right? Let's talk about how it was and how you were. What is it that you experienced as a child?
Thank you, Winnie, and good morning to all viewers watching us. I was born blind with a condition known as retinal detachment, but my mom and the family came to know about it when I was 8 years. So between that time and the 8 years when I got the real diagnosis, it was kind of a very harrowing experience for me as a kid, because you are a child, very innocent, you don't understand what is happening to you, and you hear people talking about your problem. This boy is blind, your mom explaining to other friends of hers and everybody that she doesn't know what to do or where to start. It so happens that for most people who are born with disabilities, they normally come from a very humble backgrounds. And so one of the biggest challenges is information, because you will get information from all manner of sources. And once you get information, is then how do you access? So for me, we knew about Kikuyu Hospital. I think it was what was near me, and that's where I would be taken for maybe checkups and everything. And then at one point when I was 5, the doctor said nothing could happen to my eyes. But there I was, I needed to start school. I didn't go to school on time. There was also not school that was known within our locality where a blind learner could be taken. So I would be taken to regular schools, struggle with writing using a pen, yet I can't see. I had light perception, so I had to sit maybe next to a window, but the teacher had to hold my hand and help me know how to scribble the capital letters, the small letters. Although I coped quite with a lot of difficulties, it then came that I would have a lot of eye aches, and then I was admitted at KNH. So that's where I got the best referral for Kenya Society for the Blind, where I went and got placed now to a school that had experience, and it was an integrated program on how I could definitely learn. But before that, it was difficult. I was subjected to all manner of solutions, including being taken to pastors to pray for me to see, being taken to hospitals, being taken everywhere, and it never worked, and it was very traumatizing.
Yeah. I mean, I can only imagine, because again, you speak to so many children, and they will tell you the same, that there's a lot of, first of all, stigma. There's a lot of misinformation and not understanding, first of all, what the condition is, and even in school, teachers sometimes not really understanding what this child needs and how best they can help them. And we'll come back to you, Samson. to then talk about, so what is it that needs to change? What is lacking when it comes, because some might assume and say, yeah, but the information is there are policies, you know, there, but still, we still see so many children who do not get, you know, to get to school where they can, I would say, get the best quality education because of, you know, this disability. But before that, Dr. Gishangi, so globally they say at least 450 million children have a sight condition that needs treatment, right? So how are we doing as a country? What are the numbers? What are the statistics telling us?
So in Kenya, let me start by first talking about the statistics of those who are blind, which is about 150,000 persons are blind. Now, when we go to children, it's about 15,000. The number may look small, but you can imagine the impact it has because this is children. Then when you go to school, we see that about 1% of the school-going children have significant problems. They may not be blind, but they need assistance with devices like spectacles to enable them engage in schools. For the children who are blind, they need access to treatment. Some of the treatment includes surgical processes and long-term follow-up until they are in their adulthood. Now, that is the more or less burden of blindness in children we have in Kenya. Now, a lot of attention is needed to provide the services. Sometimes, as Samson has said, it might not always be easy to access. But as a government, we make effort to reach out to where these children are. Also, when we are communicating like we are doing today, we are telling the caregivers that we are there, we can provide services to children who are blind and also those who need other assistance and correction to engage in school life and so forth. So that is the situation in Kenya.
Yeah, and again, like you said, the numbers might seem low, but again, the impact is really high. But I was also reading, and they said some of this condition, especially for refractive errors, most of these cases actually go undiagnosed. So potentially the numbers could be higher. It's just that so many other cases that have not been diagnosed. And Sheila, how much of a problem then is this, and not just to a child's life, but also, you know, when it comes to education, which Samson alluded to?
There is an impact to a child when the child suffers visual problems. It affects the attention of the child in school. It affects the retention of knowledge because the child is not, or the learner is not psychologically settled. It also affects the child by bringing in a lot of stigma. Because I am here, I'm in this class, I can't see like my peers. So the government has invested in policies, and one of the major policy that guides the issue of eye health, nutrition and other aspects is the Kenya School Health Policy that was revised from the 2009 one to 2018, which established the Comprehensive School Health Program. And here we are looking at a school that can be child-friendly, a school where the child will be taught how to take care of their eyes, the child will be taught how to prevent eye loss, child will be taught how to go out and play, exposure to the sun, aspects of nutrition. So when a child has knowledge on the issue of eye health, together with their teachers, because capacity building of the teachers is very important. So then when we have this knowledge and we are able to prevent eye losses like the uncorrected refraction errors that you're talking about, other myopia issues, trachoma and other diseases, the child is able to settle in school. The child will be placed appropriately. If it is a condition that needs specialized interventions, corrective surgeries, counseling, then it is possible for the child to settle down, and this enhances learning outcomes. And when learning outcomes are enhanced, the nation is developed, the community is developed, and this child is able to integrate him or herself into the society appropriately. So for the Kenyan child, the government, through the Ministry of Education, is fronting for child-friendly schools, very keen on eye health, nutrition, and other aspects that support the child in class and even outside the class, because it is about school. The same child is in the community. The same child will be found even in other settings like health settings.
Yeah, I see that. And when you talk about child-friendly schools, I know there's a whole conversation about, first of all, special needs schools that are government-run and government-funded, which are very few compared to private ones. And like Samson said, at age 5, he needed to start school. But then again, you know, there was either nowhere that there was close to him, or there was that, you know, whole aspect about information. And there's also this other side of the debate where they say, instead of taking children to special needs school, how about then integrating, right? The schools, just to make sure that it is child-friendly and every single child has gets the best quality, you know, education. Doesn't matter whether you have a disability or not. So I wonder where you stand on the same, but I'll come back to you as you think about it. So David, again, still working with the communities very, very closely. Samson, and I think Dr. Gishangi also mentioned the whole aspect about information and access to that. And I think you also mentioned a little bit on information. So the big question is it misinformation? Is it completely lack of information, or what exactly is it that proves to be a bit of a challenge that so many children either get treatment late or completely do not get treatment at all?
Yes, let me say that most of our cultural context define, in most cases, the actions that we take when it comes to seeking healthcare services. So you'll find that beliefs around the alternative medicine at the community level, beliefs around curses, bad omen, equally will influence how the parents will prioritize the health-seeking aspect for this child.
Yeah.
Also in terms of just looking at access itself, you may have the goodwill, but the distance, as we know, in most parts of this country, some of them you have to cover even over 100 kilometers before you can reach a health center.
Yeah.
And at times you are there, and the best you can get is very basic treatment, and you require more specialized. For children, it's quite expensive, and so most of them you'll find that they have to travel all the way, say from Mandera to Nairobi, to seek specialized care and treatment for this child. So I will say that information could be there, the goodwill could be there, but equally can be very frustrating when you lack the means of transport, when you lack the finances, and equally when the child needs other care other than just the treatment for eye care. Because what we have seen is that an entry point being eye care can also be an entry point for other health conditions, which could be like diabetes and so many others.
Yeah.
So it's a range of so many factors that can compromise, not just information alone.
Okay, I see that. And Samson, again, as a child, how much of an impact was this? Because I know you talked about, you know, information. You got your diagnosis at around 8 years old is when you got proper diagnosis that this is what, you know, was happening. But prior to that, more of like, yeah, let's try this, let's try that, you know, let's try if this works or not. So how much did this impact you as a child? And we're talking about all facets, education, your interaction, you know, with the others, yourself, you know, as a child growing up. How much of this did it impact you?
Now, come to think about it in this day and age, it impacted me in very many ways. Because you are there born with a visual impairment, you are totally blind. One, the support system does not really know what to do with you, how to take care of you. Then you will have all manner of solutions being given. So you end up missing a lot as a child. You end up missing play, especially where by 2-3 years you need to start playing. You are overprotected because you'll hurt yourself. Nobody wants you to go out. I remember I would stay in the house 24/7 until one time, because still my mother had to go and fend for us. So I would be left in the house all by myself. So that hindered me from accessing play and socializing at the age where other kids will do the same. But my neighbors then said, we will be taking care of him. You leave him to us, because sometimes then the parents think leaving a kid who is blind to other people is
They
a
will
burden to
not
them. It's a
understand,
bother.
yeah.
So you find now families started volunteering, and they said, no, this is just a kid like us. We will take care of him. He must play. The other point is also how other institutions around you maybe treat kids with disabilities.
Yeah.
And for me, I can actually speak for churches. There are churches where disability is a problem. It's something that should be eliminated by all means, through prayer, through miracles. And you find that is a lot, it's stigmatizing. Because then this kid will grow up knowing they have a problem and it's not good. But then they cannot help themselves do away with that problem. So I think my call to parents is instill the right attitude, because disability again is about what kind of attitude are you having towards this disability. If you have a positive attitude, this kid will grow positively, knowing we're not all the same. Yes, I'm blind, others can see, but I can do everything and become independent. And for me, I think the church I found myself in, Orthodox church, they did not see any need to like pray for me, or they looked for ways for me to learn, go to school, and supported my education. And that is what has brought me to the level at which I am today, because you find people who know that there is no mistake with you having a disability. The environment only needs to be right. And even when you talk about integrated education and special education, it's just a matter of integrated education would look at the learner as the problem and then make adjustments to favor that learner. But today, I think inclusive education is what our policy prescribes, so that you look at the environment and the attitudes that people have towards the learner as the problem. And once that is rectified, we all get into a world where we can all learn, because after school, in university, there is no university for children with disabilities. There is no employment for children with disabilities.
I see.
So we love children by giving them the right environment and approaching them with the right attitude. Thank you.
I see that. And I really, really appreciate that, because again, one of the things that we are to address is the whole aspect about attitude and stigma, and how do we change that? Because again, if we start by changing our attitude, then everything else, we approach it positively and see ways of finding solutions other than seeing this as a problem, which is very, very integral to what Samson said. All right, Dr. Gishangi, you are up, but I do not want to rush you into my next question. So how about we take a break, and then when we come back, we'll start with you and would want to understand, so what are some of these common conditions or issues that we see affecting children, and especially, when it comes to like the eyes, the sight, because there's sight, then there's vision, and then there's, in between. So what are, some of these common conditions, and what is it that we can do to better the lives of those children without necessarily seeing this as a problem, and we need to sort of like more of a change towards helping them, but really including them, right? And especially in schools, which again, Sheila would also touch on. But all that is coming up after the break. Stay with us. The show is your world. If you have any other question, feel free to engage with us on our socials, and that is at NTV Kenya, both on Facebook and on X, and we'll try as much as possible and answer all your questions before the end of the show. See you after the break. All right, welcome back. Of course, the conversation still continues, even during the break. And like I said, today we're having, again, a very important conversation that really should not only wait until there's a specific day, in this case, World Sight Day, for us to talk about. No, this is a conversation that we should be having every single day, in all, in our WhatsApp groups, or chamas, when we go to churches, or, places of work. We should have this conversation every single day, and this is protecting, eye care as far as our children are concerned. And that is really the subject of this year's theme. And this is focuses on eye care for all children, but also love your children's eyes. And that is what we're focusing today on the conversation. That is, what is it that we need to do more to promote, first of all, good eye care for our children, but also help our children learn how to love their eyes, okay? And before we went on a break, Dr. Gishange was to ask you this. So what are some of the common conditions that we see affecting children? And this is as far as, conditions, diseases of the eye.
Thank you, Winnie. Now, among the conditions that bring about blindness in the childhood life are congenital. Congenital means the children were born with them, and some examples are cataract. So we describe that as congenital cataract.
Yeah.
Cataract a child is born with.
Okay.
There are other conditions like, again, congenital glaucoma, which means that this is a condition a child was born with. Then there are other diseases called corneal diseases involving the front part of the eye, the clear part of the eye. And then we also see significant causes of blindness from something we call retinopathy of prematurity. And what it is that now we are moving forward in development. Some children are born slightly earlier than the time they're supposed to be born, and they have associated complications. Again, we also see children who rub their eyes. Some of them do it so vigorously and so forth, and may lead to loss of sight, and so we need to take care of that. Now, for the school-going children, what you had described as refractive errors. Refractive errors is short-sightedness or long-sightedness or some other conditions we call astigmatism, causing significant loss of vision, and that not enabling them to engage in school. Now, in that life course, we have strategies to see how to identify them and appropriately refer them or give them the services. For example, those who are born with eye problems or blindness at birth, we encourage that our service providers, our eye health providers, or even general health workers, just examine the children at birth.
Okay.
And if there is a problem that is, just to say it is not, the eyes are not just like any other, then that is a reason to send a baby or an infant or a neonate to the right place, to the eye doctor, to examine and confirm what that is. There are some diseases like what I described as associated with prematurity. Again, we deliberately go out. For the children who are born very early, we screen for the problem. And if we see that they are likely to lose sight because of that, then we address that in time. And we are using the approach we are describing as integrated people-centered eye care, where we go through the aspect of giving health promotion, disease prevention and so forth to the members of the community, so that if you identify a child has a problem or even the eye is turning outward or inward, then just present the child appropriately. Again, we also work with teachers, because teachers are very good in identifying a child who is not behaving like the other, and that way a child is identified and referred. The other thing we are doing is that as we continue to develop, we are also developing our health system. We continue to train more workers. I know it is difficult to train, especially health workers, and so we train and equip them ready to address the diseases of children. The diseases of children really require highly trained people, high complex equipment, and so forth. But over time, if I were to look at the way things were 20 years ago and now, there's some improvement in that. And also, this is the reason why we continue talking to the members of the public, to our health workers, because when we improve in provision of, in availing some of these services, then we also would be happy that the members of public are able to come up and consume the available resources. So
I
those
see
are the
that.
approaches.
Yeah. But the biggest thing that most people would talk about is cost of care, right? Which I'll come back to you then to see what some of the policies, you know, surrounding the same when it comes to cost. Because most parents would say, yeah, but I would like to take my child to get the best quality of care. But then again, the cost is, you know, it's higher. We cannot afford that. So then what happens? Are there, you know, policies? And now that we're talking about SHIF, right? What does that, you know, cover, especially when it comes to eye care for children? But before that, so Sheila, can we talk about then some of those policies that the Ministry of Education has put in place, just to make sure that, number one, you do not get late diagnosis, you know, of some of these conditions, which could either be prevented or could be treated early with proper diagnosis. And the second one was the whole aspect about integration versus inclusion, which again, Samson brought up a very important point that, you know, we should also look at. But yes, can we first of all start with some of these policies?
Yeah. So, as I had said earlier, besides the Constitution, the Kenyan Constitution that talks about the right of a child to compulsory basic education, and also the highest attainable health, the Basic Education Act, Vision 2030, the Children Act of 2001, the policy that fronts for inclusion of health practices and other perspectives of eye health to be relevant to this discussion is actually the Kenya School Health Policy of 2018. Okay. It is in this policy that we have established comprehensive school health programs. We are looking at schools that are able to support the learner. And why schools? Because schools provide viable ground where it is easy for one to walk in and attend to a big number of clients in this conversation. Okay. Children, teachers, heads of institutions. It is possible to implement these policies. And so we are collaborating with the Ministry of Health and other line ministries, organizations like CBM. We also partner with Kenya Society for the Blind. Actually, we have a ministry representative on the Kenya Society for the Blind board, so that these initiatives are implemented within the schools. We no longer want to have this narrative where it is claimed that we develop so many policies and they are shelved. So we are training, we train TOTs. We also bring in the issue of ambassadors, vision ambassadors and vision volunteers who can go into the schools, screen, identify, refer. And when we talk about referral, we are now bringing the aspect of both functional assessment and also the medical assessment. So once this child has been diagnosed with a visual challenge, whether it is treatable or not treatable, they are then they proceed for the medical assessment. Then from there, like for those who have visual disabilities, determined to have visual disabilities, we then work with the National Council for Persons with Disabilities for registration. Why are we registering? We have the affirmative action. The Constitution and other legislature entails that these persons must have access to universal health care, appropriate services that can help. And that is how we bring in the issue of ATs, assistive technologies, that can help support. If you have low visual challenges, can we provide you with services or equipment or ATs that can support you to be able to utilize the sight that you still have? And if you have total visual loss, can we provide you with ATs that can at least bring in a level of independence, so that you're not dependent the way Sam said he depended on the neighbors for movement, for everything. So that is the main policy. We also have the sector policy for learners and trainees with disabilities, which is anchored majorly on inclusive education, and that is an interesting conversation. Inclusive education means a learner or a trainee should access education from the nearest school. And as Sam said, that brings in the issue of resources, adaptation of the environment, specialist teachers, because I'm a trained teacher, of the deaf, I will not be able to handle a learner who is who has total blindness unless I have the expertise.
Okay.
The issue of adapting the curriculum so that these learners benefit for both totally blind and those with low visual challenges. The issue of stigma, enhancing acceptance. As some said, we are the same. These are the same children within those classes. So the Ministry of Education is pushing hard for inclusion where possible.
Okay.
We are not writing off special schools, but
yeah.
if a learner or a child with visual disabilities can thrive in an inclusive setting, then why not? And if a learner cannot thrive in an inclusive setting, then let that learner access an institution that has specialists and specialized services.
Okay,
Thank
I see
you.
that. Yeah, because we were talking about this during break, and we said sometimes we have these policies in place, but then again, the people who need it the most sadly do not, get the services. So it's good to see that it doesn't just mean that we have these policies, but we really take it to the schools, and especially with marginalized communities and and all. So David, I understand those are projects that is implementing the Vision Impact Project. Okay, so can we briefly talk about this, because it's very, very important, right? So can we briefly talk about this project and some of the key achievements? First of all, the lessons that were learned, what was discovered throughout the project, and the key successes of the project.
Yes, we have a Vision Impact Project that is supporting strengthening of eye health systems in Kenya for 7 counties. That is Kwale, Embu, Meru, Kajiado, we have Kiambu, Bomet, Vihiga. And basically we're working in 2 fronts. One is school-based activities in terms of screening, treatment, and 2 is around community-based activities. Now, in terms of schools, so far since 2022, we have been able to screen over 1 million children in schools, out of whom about 250,000 have one condition or the other in terms of eye health problems. And we have given out over 4,000 spectacles. Those are for readers. And also operated over 400 cases in terms of cataract surgeries. So I can say, working collaboratively with the Ministry of Health, Ministry of Education, the community gatekeepers, Teacher Service Commission, and also the Council of Governors and the county governments, we have really been able to succeed in terms of reaching the population. But the most important bit of it is that in schools, we are trying to model out at least 1 model school in each county to be more inclusive, be more accessible, and also supporting the capacity of early assessment resource centers, those are the EACs, to ensure they have appropriate skills, appropriate equipment, to do what we can call early detection and intervention and appropriate placement for the learners with disabilities. So I just say that the main challenge that we have is actually the need is massive. But at the time of planning, we thought only 4% could have an eye problem, but now we have over 15% who have an eye problem. And through one project, we cannot meet all the needs. That's the biggest challenge, that we call upon other entities to support.
Collaboration
Yes,
as well.
collaboration.
Because the bigger goal is to really, really help our children because we do not want, cases, and especially for those, issues, conditions that can be prevented. If we can prevent them, the better, so that to better the lives of our children. So Samson, I can see your time is far much spent, and I just wanted to hear from you. So based on your experience and how far we've come as a country when it comes to addressing some of this needs and what needs to be done so that every single child with or without a disability can get the highest quality of education and healthcare, from your perspective and where you sit as the CEO of the Kenya Society for the Blind, what is it that has worked, what has not worked, and what is it that we need to sort of prioritize? Because I think Sheila mentioned, the whole aspect about priorities and what we need to prioritize. So from where you sit, what is it that we need to prioritize as soon as now?
Thank you, Winnie. Kenya Society for the Blind is a statutory body created through an act of parliament. So we are a government agency per se, but we are created as charitable, meaning we don't get any funding from the government. yet we have a responsibility in terms of mandates, one, to assist in the prevention of blindness, but where the cases are irreversibly blind, we then come in to address issues of inclusive education, rehabilitation, employment, welfare, because even other children lose their sight at a later stage, like in high school or in primary.
Happens,
So you then need to bring in rehabilitative interventions for you to make those children functional. We are dealing with a case of a child who has lost sight now as a Form 4 candidate. And so we'll have to use our experience and to work with NEC so that that learner also does the exam as expected. So what has worked is partnerships, because Kenya Society for the Blind, not being funded, okay, you could look at it as an issue. But then what have we done? We've been able to drive partnerships that have lessened these challenges of resources and challenges of schools. Like now with CBM International, we are part of the Vision Impact Project, and we are now funded to bring these interventions. And just as David alluded to, within the inclusive education, we want to have these model inclusive schools. One, eliminating environmental barrier.
Okay.
But attitudinal barriers are not easy to remove from people. But we are also doing champions of inclusive education, where we train stakeholders, board members, parents, teachers, so that at least from them they can start becoming models who can drive the conversation of inclusivity, so that even these learners who have problems with their sight are not left behind in their families and in the community. Then what we need to prioritize currently is then how do we help every learner, either who has a disability, and here I'll speak to any type of disability, for them to thrive in education, because the conversation we're having today, it's not only about eye health. It's not because it's World Sight Day, but it's a conversation that has massive socio-economic implications when you look at it in future, because children are our future. And if they don't get the right intervention, then it means by the time they're supposed to be productive and helping this country, we will have no people. And I can tell you, most of these children are very bright. It's only that they don't get an opportunity to succeed in where they are. But I think the biggest problem is how the society approaches the issue of learners, because the greatness of any society can be judged by how it treats the less marginalized or the vulnerable. And you'll find one of the point of departures is using sympathy to address disability and not empathy. So you just want to pity this person, you'll not help them. But you then find that if you have empathy, you look for solution, you'll give them resources, you'll get to know what right material they will need for their school. And I'm happy because the government, I think through the Ministry of Health, has also brought a very big program into the country called ATScale. We are working to see that we can bring a lot of assistive technology to our country. We have a strategic plan, and now we have a policy. And we have funds, at least for the next 3 years, to drive the whole spectrum of AT, giving devices, but not only giving, but training. Training even people who can maintain them, and making sure that this also is made as one of the sustainable milestones that can continue supporting children in this country.
I see that. Thank you very much, Samson. So I can see literally we need to be out of here in the next, I would say 6 minutes. I know time flies. So the bigger goal really is to create a world where every child has eye health that is accessible, like we said, available and affordable. And Dr. Gishangi, you want to speak on then, so affordability really. What is the ministry doing? What is it that needs to be done so that we do not leave any child behind simply because they were not able to afford, to get some of the services they really, really require? And as your parting shot, then because I understand there's that provision by the Ministry of Health that every child should have basic eye examination as recommended again by the Ministry of Health. So then integrating that and making sure that, we talked about screening, as well. How do we make sure that this is done at all levels, really? It doesn't matter whether you are in the city or you are in the most rural parts, screening is done. So would you want to speak on those two in the next maybe a minute.
Yes, so thank you very
Okay.
much, Winnie. And
Yeah.
I want to say that Matters Health financing is very real and crucial if we are to achieve universal health coverage. And when you say that the cost is high, it's true, the cost may be high. And when we look at cost, we look at cost of the service itself and also other costs that the people who are seeking services in car, like traveling from Mandera to Nairobi, that is quite a huge cost. So we look at it in those aspects. First, let me start by saying that even as we move to the social health insurance, we have taken into consideration that child eye health, priority issues are factored in.
Okay.
The other thing is to reduce the cost of the service consumers or the patients. We have made effort to see that our specialists can move, especially from Nairobi or the big cities where they may be, because there are few, to some counties where otherwise the patient would have moved to. For example, the specialist in Eldoret makes effort to go to as far as Turkana now to address those issues. That reduces on cost. And children who would never have made it to Eldoret
They
would
get the
access
services where they are.
services
Okay.
where they are.
Okay.
So those are some of the efforts that we are doing with respect to that. However, no child should remain blind. We have different ways of addressing those and seeing how to raise resources, because as we have said, child sight is very special. It is very useful for the development of the child and engagement in schools and quality of life at the end of the day.
Okay.
So we should not let a child live with blindness and visual impairment. And
not get the necessary help and
yes,
the
yes,
resources
we'll
that they
make
need
all
to
effort to
thrive.
ensure that that happens.
Okay.
Yeah. Thank you. As I possibly conclude on that.
Yes,
we-
yes.
so
In the next 30 seconds.
So we are telling the members of the public, any child who has visual impairment or any child whose eyes are not just like any other child, let them come for services into the health system.
Okay.
We are equipping even the CHPs, community health promoters, just to be able to identify that this child has a problem, go to the next level of care. And then from there, they'll be referred appropriately.
Okay.
What can be treated at different levels will be treated. We know that mothers are very good in noting that this child is not
Identifying some
like
of the
any other,
Yeah.
and we take cognizance of that, and we are encouraging them to work with the health system so that they can be referred upward for appropriate services.
I see that, because majority of the times people say, so then where do I go? Who's the first person that I see? But it's good to, again, like you said, point is go to the nearest health facility, and then from there, referrals can be made depending on the need of a child. Okay, Sheila, I'll come back to you to then conclude, this whole conversation today. But I just want to hear from David very quickly, because like we said, David, there's so much that can be done. There's so much that has been done, and especially, paying tribute to the role of partnerships and collaborations, which is very integral. So, what will be then your clarion call as CBM to ensure that really, like we have all emphasized, that we do not leave any child behind just because they have a special need in this case?
I'll say that every eye is an eye, and it is possible to have a generation free from avoidable blindness. Currently, I'll say that we need to go beyond one sector solution, because eye health is not just a health issue, it's a development issue. So we need to bring on board all other sectors to find a sustainable solution, and also work collaboratively through the private partnership model. And I'm sure when you do the public-private partnership model, you can achieve much more than working alone.
That's
so it's
true.
possible to make it happen.
Yeah. Oh, I like that. What a way to end the conversation. All right, Sheila, so close this for us. So it is important to have this conversation on World Sight Day, which again, like we said, will be tomorrow. But again, we start the conversation early because it's important to drive this conversation, right? What will be the clarion call? What is it that needs to be done? David really spoke mostly on partnerships and collaborations and just, working together to make sure that every child is taken care of. But what will be your clarion call?
Yeah, the vision of the Ministry of Education is to provide an inclusive and equitable quality education, training and research. And you can see that the issue of eye health falls under education because issues of health also require knowledge, skills, as Daktari said, skills and the right attitude. And so we are calling out to just our parents, our teachers, to inform them that we have institutions in place. The government established the National Assessment Center at Kenya Institute for Special Education. It's our national assessment center. We have other assessment centers in the counties where we have our EAC officers who support functional assessment. We have established referral pathways with Ministry of Health where any child who has been assessed will be referred either for corrective surgeries, for interventions, for support, whether educational or medical. Like educational, we have the individualized education plans. We have medical interventions, follow-up, and even placement in the right institutions. We have Kenya Institute for the Blind, which is mandated to adapt teaching and learning resources for our students with visual disabilities and also offer rehabilitation just like Kise. We are working with partners, and just to support David, we are calling for public-private partnership. Government is on a journey, and no journey can be effective if we take it single-handedly. We are calling for all relevant stakeholders, like-minded partners, to support government, support Ministry of Education, Ministry of Health, to make sure that this conversation of eye health, inclusive eye health, and even nutrition is advanced to the highest and even the lowest levels possible.
Okay.
One more thing in 30 seconds.
Okay.
There is help and there is care at Kenya Society for the Blind, just as I was referred to the right school. Today we are launching a model eye hospital that will have all services, especially for children.
Okay.
Because one of the neglected issues among children is low vision also. These are people who are neither blind or sighted.
Yeah.
They need some specialized equipment.
Okay.
And so we'll be launching that so that after some medical intervention has failed, we then have a rehabilitation facility there where you can be taken through counseling, you can accept yourself, and you can be ready also to conquer the world with your newly found condition.
Yeah.
So we invite all Kenyans to always seek out for these health services are there. Thank you.
Absolutely. So the help is always there. All right. Thank you very much, Samson. What a way to end the conversation this morning. But again, it doesn't end here on the show. Let's keep the conversation going on our socials, and that is at NTV Kenya, both Facebook and on X, and in your respective WhatsApp groups and in your groups and at workplaces, everywhere where you can have this conversation. Let's please keep the conversation going so that, again, people know where to get help. But for now, allow us to say goodbye. Mr. Samson Oweru, CEO, Kenya Society for the Blind. Thank you so much for your time. Dr. Michael Gishangi, Head of Eye Health Section from the Ministry of Health. Thank you so much for your time. Sheila Luta, Assistant Director, Ministry of Education, Special Needs Education. Thank you so much, Sheila. And David Munyendo, who's a Kenya Country Director, Christian Blind Mission. Thank you as well for your time. And we hope that, come next year, we'll have a different conversation altogether as far as World Sight Day is